distractions. For instance, the jawbone ischemia can be from someone who smokes cigarettes, or from a protein C or protein S deficiency, or a blood clotting disorder, or someone who takes certain types of drugs like Imitrex, where the reason that the person has a headache is because the blood vessel size is large, and so in effect the drug tries to make the blood vessel size smaller so the person doesn't have the bounding headache. This reduces the blood flow to the jawbone as well. So what's the big deal? Well, energy can't go through dead tissue. No, it's not a burden for everyone, but it is a burden. Does every area require surgery? No. Nattokinase, lumbrokinase, and proteolytics are being used for those patients who have clotting disorders. There's also promise with low-level laser that's being used in some of these areas in order to improve the circulation of the blood to the jaw. There are also some homeopathics that can be used to help the person that has a clotting disorder or problem with circulation to the jawbone itself. There are some areas that will require surgical intervention. Remember, the electric flow is invisible, not imaginary. Let's put a lamp on a table and plug it in and then turn it on, and we see that the lamp comes on. If I unplug the lamp and I get an X-Acto knife and I trim open that rubber cord, peel it open, and I get a pair of scissors and I cut out an inch of the wiring that's in there, fold the rubber back and then plug the cord back into the wall, you'll probably understand why the lamp won't turn on. Because the electricity cannot jump the gap of where there is no wiring. And yet, in the instance of a root canal or an area where a tooth is taken out and there's dead bone, there's a small area in the jaw that the electricity cannot flow through. Your body was designed to be able to have electricity flow through any part of it, whether it's an EMG, an EKG, an EEG, it just doesn't matter. So what happens when there's a short or a blockage? I believe that God designed a perfect immune system, one that can pick up a phone, dial another part of the body, and say, hey, we have a problem. I need you to activate some T cells and some B cells so we can take care of this problem. In other words, clean up on aisle 9. The problem comes in when we have a disconnected phone cord. No place else in the body do we take out nerve and blood supply and expect to keep a dead organ in play. This X-ray shows you implant materials that are in place. There are several implants, and if you look at the tip of the white arrows, you'll see that is the floor of the maxillary sinus. You will also notice that these implants have gone beyond that floor, making them foreign bodies. The typical implant material used in the United States at this moment is titanium. Titanium can suppress a T cell count. It is a very conductive material, and the problem lies in if I were trying to take a fork and I stuck it in an electric socket and I bent it around and stuck it in the bottom, I could short out that entire circuit. That seems to be a problem here with the meridians when we stick so many different metal conductive titanium implants into multiple meridians. You see, the meridians are much like the circuits in your home. Here I have a lamp in one room, a dishwasher in my kitchen, and a washer and dryer in my laundry room, and they don't work. I go out to the breaker box and I see that one breaker has tripped. I push it back and everything seems to work just fine. But on another day when the same thing happens, none of the switches have tripped. I call 2 electricians to come out. One tells me that he's going to have to replace all the wiring in my house because my house could burn down. The second one comes out and uses an ohm meter to check 2 outlets that are between my breaker box and my lamp in the bedroom. When he finds that there's no power going to the second one, he takes a screwdriver out and removes the wall plate from the wall. He simply reconnects the wire and finds out that everything works just fine. Some dentists have equipment that they can use that will allow them to be able to tell if the flow of electricity in a particular area is causing the problem. This is a slide showing the acupuncture meridians, where a flow of energy can go up and down the different meridians. The testing equipment oftentimes uses these meridians. Here in the United States, we seem to think that they are imaginary instead of invisible. Dr. Kim Bon-han demonstrated that the meridians do exist. He injected a radioisotope into an acupuncture point. The flow could be seen following the meridian, not an artery or a vein or a nerve pathway. This is an analogy of the meridian. Here I see a freeway that's temporarily blocked by water. If you went to an acupuncturist, he may be able to increase the flow of qi on a particular meridian. That would be like me taking a giant vacuum cleaner and being able to remove the water from the freeway so that I could temporarily use the freeway. But if that water is there because of a broken dam, then I'm only going to end up with another blockage. So the end point should be finding out what the root cause is. Here are some old charts that have been around for many years. This particular chart shows the correlation to the teeth and different muscles. Here's another old chart that shows the correlation between different teeth and different organs in the body. You see, acupuncture has been around for a long time, but it's actually the Germans that many years ago started linking the teeth with different organs. This chart is color coordinated so that you can understand how the teeth are on different meridians. Up to now, I've done a pretty good job of explaining to you how a tooth can interfere with the health of your body, but the health of your body can also interfere with the health of a tooth. The arrows are pointing to fillings that are on two teeth that are related to the lung and large intestine. This particular patient has had changes in her bowel habits. This could make the teeth more susceptible to decay. That's the theory that we're looking at. Sometimes a patient will come in with a toothache, and we find that it's not the tooth at all, but referred pain from the organ that requires additional help. Could my mouth really be the source of my health problems? Well, research is now pointing us to links with biofilms and cardiovascular disease. Secondary infections from hidden dental infections can happen any place in the body. The following information that I have to provide is thanks to Bob Jones and all his hard research. This is the link to the oncogene, or the cell that has to do with apoptosis, known as P53. It also has to do with the P21, which has to do with the cellular replication rates, and the CDK2, which has to do with the cell size. It seems that the bacteria inside the root canals, which is so mutant, can affect all of these three things in the body. It means that your immune system can't function like it's supposed to. So in the instance of cancer, we might say that a root canal and the toxins that are in there could be affecting the patient's ability to fight a tumor. It also means that the body could be so toxic that maybe a pancreas is not functioning like it's supposed to, and the patient has been clinically diagnosed with diabetes. And yet, when the mouth gets cleaned up, the diabetes goes away. The example that I use is when a woman is pregnant and she gets gestational diabetes, or if an individual is overweight and they get overweight diabetes, and they lose the weight, or they have the baby, and the diabetes goes away, it means that the diabetes was conditional. So here, if we have a patient that's diabetic and they do get their mouth cleaned up and the diabetes that was clinically diagnosed seemingly goes away, then my analogy would be that the body was so toxic that the pancreas could not function like it was supposed to. Dr. Thomas Rau runs the Paracelsus Cancer Clinic in Switzerland. His research showed that 98% of women with breast cancer had one or more root canal teeth on the same meridian as the original breast cancer tumor. Dr. Weston Price found that root canals were deadly in 1925. I suggest you do your homework. So could the state of your health have anything to do with your mouth? Could the state of your teeth be a direct reflection of your health? How much good health are you willing to give away? Do you need a biological dentist? Visit www.iabdm.org, which stands for International Academy of Biological Dentistry and Medicine. Be a wise consumer and ask questions. After all, it's your health.